Alright guys, I'm just reading an article that fucking pissed me off, that fucking ticked me off the fucking rails, and it's on Reddit. It's a case of Medicare fraud. You'd think this is a case of moral hazard by the patient, but no, it's actually a fucking, it's a case of adverse selection by the fucking healthcare providers. Just get this, right? The officials are said to have been involved in more than 6.5 billion claims submitted to insurers. Submitted to insurers to use the proceeds for fancy jewelry and luxury cars. That's how the fucking doctors who are supposed to be guardians of your health, supposed to be nourishing you back into life, that's how they fucking take the insurance claims for themselves and then use it for their own profit. It's fucking scummy. Just get this, right? So there's a doctor that is charged in Florida for an $89 million healthcare fraud scheme. And it's basically what they're saying, like they're giving like cardiology, they're giving out heart tests for athletes. And basically they given to them seemingly for free, right? But no, actually they have to like send it up to the insurance company. In order to do that, they have to say there needs to be like a I don't want to say subsequent, but like a justifiable reason for them to have that test in order for the insurance company to pay out those costs. And so what they would do is that they would fucking falsify that, right? Falsify it, send it to the insurance company, say like, okay, yeah, you know what, this guy needs like a normal heart test. I'm kind of making the word heart test more understandable to y'all. I think it's like some kind of like cardiology test. It's basically for fucking athletes, basically seeing if they're like at risk for any cardiological problems. And one of them, because they sent normal test result images, right? One of them actually died due to an enlarged heart because this guy decided to cut corners and take the profits. Just think about this. So in one instance in 2024, the test results actually revealed a significantly enlarged heart, and the teenage patient later died on the basketball court. Okay? And it's not just this doctor. So they would go around across the country, and some of them weren't even like didn't have the right credentials according to this article in order to like thoroughly examine them for symptoms or whatever of any sort of like cardiological issue. And so they would just like call this doctor across the country and just be like, hey, yo, what up? Like, we need you to like check this out. And then this doctor would send falsified documentation of what's supposed to be like a normal test result to these companies, to these insurance companies, to justify a payout so then they can get the money for themselves. It's really fucking scummy. And so what they would do, like, in order for them to like facilitate these tests for these athletes and stuff, they would give kickbacks. If you don't know what kickbacks are, it's basically bribes. And one of them was a hospice owner, and it's said to have paid kickbacks to a funeral home employee for information about deceased Medicare beneficiaries. Right? So if you're still confused about what is so scummy about this case, it's medically unnecessary. These tests don't even need to happen. They're just preying on the fears of these athletes to come in and take a test, and because it's unnecessary, they can get the doctors and the medical the medical care providers can get the money because they went in for a test, even though they know that it's blatantly, it's not even needed. They just get the profit out of it. So this is a fucking adverse adverse selection. When the healthcare provider has more information than the patient and doesn't let everything in, and doesn't let them in on everything that they know, you get fucking scummy situations like this, in which they're able to profit off of them while the other one is in the fear of endangering their own life because maybe they didn't get an unnecessary test that they didn't need. It's fucking I know I'm cursing a lot. I'm cursing like a teenager, but this is blatant fucking Medicare healthcare fraud. It's fucking ridiculous. Jesus fucking Christ, man. Like 89 million, the heart doctor I was talking about, $89 million alone for that. And this has been going on for years. This has been going on for years. This has been like a whole system of people willing to cut corners so they can make an extra buck for themselves. And it's not just this doctor that is the worst part. It's the healthcare providers. It's the people that are supposed to subsidize this healthcare, make it more affordable to us Americans. And they get to reap the profits off of it. All the while, healthcare costs rising, right? We have like for the quality of care that it's supposed to be deemed and the quality of life, like the quality, the cost of care that we have, it does not justify the quality. No, the quality of care does not justify the cost of care that we currently have. It doesn't. I don't care. I don't care what y'all say. It does not. This healthcare system is so fucked. And the fact that this Trump administration will probably let this one slide, which it's not going to be surprising. They've let like so many other things slide, like in terms of fraud, not just fraud, but crime. And I'll send this. I'll put this link in the description. It's by Eric Tucker, the author, and it's on AP News. Yeah, that's all I wanted to say. Just like people who are supposed to be protecting us don't tell us everything, keep the profits to themselves, all the while fear-mongering among the patients when they should be looking out for them. Fucking disgusting.